Hi guys. Hello everybody. Okay, so I know this is going to be a couple seconds delayed, but when you see this, let me know if you can hear me. Thanks everybody who has tuned in. If you're super new here, this is a weird way for you to start watching a video of mine, but I'm Liz and I'm a family nurse practitioner. And I released a video like a week ago talking about coronavirus and what we're doing outpatient. And then this one is kind of like an update. I'm going to do a brief, I have a couple points on my sticky note that I want to talk about. And then I got a ton of questions, and I just thought I would kind of cover the questions from an outpatient basis because I feel like a lot of the information online is from an inpatient basis. Also, I know the video is kind of blurry, but it is what it is. I don't know if it's my computer or what, but we're gonna roll with it. Okay, so first thing, okay, perfect. People are saying they can hear me. Hi, everybody who's here. So I'm gonna go through these, like I said, go on my little list of things that I just wanted to update and talk about. And then we'll go on some rants, and then I will answer questions on here, and then the ones that I got through Instagram. Okay, so telemedicine update number 1. Last week I did that video on how to implement telemedicine in primary care. The easiest thing that I have found to do is Doxy or Zoom. Doxy is nicer, it's way easier. The workflow, you can just text someone from the program and they can hit a button and it pops up. So much easier. You do have to pay for it. One version is free, but you can't text them through it, so it's not very helpful. I would get the paid version if I was doing it myself and I was like controlling everything. Where you're mostly using that for Medicaid patients because Medicaid patients need video in order to be reimbursed. It's not going well. I won't lie. Patients who are Medicare are typically older, 65 and older usually, and they are really, really, really struggling with anything. We've tried Zoom. I have tried Doxy. You could do FaceTime. However, then you're giving them your personal number, and that's kind of like, and they don't all have iPhones. It's also assuming that your patients all have access to an internet and like usually a smartphone or a computer. And that's assuming a lot. So that's been hugely problematic. I've been successful like twice, and I've probably tried like 30 times. So with them, a lot of times we're billing for time, and it's not ideal, but I mean, it's better than nothing. It's worked a lot better in younger populations, but however, younger populations, if they have commercial insurance like Blue Cross Blue Shield, you can actually just do a telephone visit. So that's been fine. So there's the update there. The second thing I've gotten a lot of questions about is how we're triaging in terms of outpatient. Like, are we being exposed? What are we doing in terms of masks and PPE and all of that? So the way we're triaging it is we're asking everybody to kind of see if we can do over the phone and do telemedicine instead of having them come into the clinic. If they seem like we need to lay eyeballs on them, say someone's having acute like weird right upper quadrant stabbing pain and we're like, oh, I need to see you. We'll screen them over the phone, see if they don't have like a fever, a cough, shortness of breath. Everybody, then they're coming in. Ideally, everyone would have a mask, but that's just, we don't have enough. We are wearing masks as of a few days ago. We're all wearing masks in the office when interacting with patients. We're having people come in straight from the car, straight to a room. There's no one waiting in the waiting room. We do have one designated sick room, which is where people go and then they are being given a mask. I don't know what we're going to do when we run out of masks, to be honest. We have like not a lot left. So that's going to be a whole different ballgame. But if you don't need to come into the office, we are mostly asking people to just be triaged through telemedicine due to our limited resources. And we are not screening. We have like a few tests that we can do through LabCorp. We have mostly gone through the health department when we're screening people, and I'll talk more about like the screening guidelines in a little bit. But honestly, we haven't been screening a ton of people just because of how the guidelines are set out for us. Let's see what else. So I'm wearing a mask all the time. We do have a sign on the door, and it says, if you have any of these symptoms, please do not come in. It has the number of the health department that you can call for their hotline. And I think that is pretty much how we're handling it and like what we're wearing PPE wise. We don't have N95s because we can't order them. They're just none to be had, and I haven't been able to find any at any of the stores or online. I guess you could go online and like pay an insane amount of money on eBay, but we have not done that yet. So we just have surgical masks, which is not ideal. But again, we aren't seeing anybody we have a suspicion of COVID, so it would just be people who come in and then are silent carrier, who are asymptomatic carriers of it. Someone said the feed stopped. Can you still see anything? Hopefully it's still going. I'll just keep talking and cross my fingers. Let's see. Who is being screened for? So if you guys have any more questions about how we're triaging it, let me know. But that's kind of it. It's not ideal. We're kind of running with it. We don't have gowns. We don't have any of that. It's just kind of winging it. Who is being screened for COVID? Okay, so I get a lot of people that come in or call and they want to be screened for it. And and we're not screening barely anyone. So that's one thing is you hear all these numbers of people and it's like who's, the numbers are so low or they're this or they're that. And their numbers, it's just, you can't look at the numbers, to be honest, because we are not testing anyone. Like this week, I probably referred 2 people to go get testing and I told, maybe a lot more than that, hey, you probably do have it, but we're not screening you. Not duh, but like womp womp. So I have the screening guidelines here. The CDC recommends that you use your own judgment in combination with this of their recommendations. So we will go over that and kind of I'll tell you how I've been kind of doing it. So priority 1 is hospitalized patients. You want to know if they need to be, if they have it. Priority 2 is healthcare facility workers with symptoms. This is not being implemented, I know, because I know a lot of people who work in healthcare are being told, oh, we're not going to do anything for you even. So that's the recommendation, but I know that is not being implemented. The reasoning behind that is because you would be exposing a bunch of other people if you had it, you know what I mean? And then you're seeing patients. Priority 2, so this is like, the second most important people would be people living in long-term care facility with symptoms, people that are 65 and older with symptoms, and patients with underlying conditions with symptoms, and first responders with symptoms. I have also kind of clumped in here anyone who works anywhere, really, that sees a bunch of people, that I'll screen them. I'll send them for testing. If you work in a grocery store, if you work anywhere where you're still interacting with the public, I'll kind of send you. They don't say that here, but that's just my little tidbit. And then the third priority is critical infrastructure workers with symptoms. So they put them in priority 3. I just kind of bump them up because, hello, like if you're working at the grocery store and you're sending everybody out, like that seems like you should be up there. 2 is individuals who don't meet any of the bio criteria but have symptoms. We're really not honestly screening them because unless it changes the care that we would be providing them. And then 3rd is individuals with mild symptoms in community experiencing high numbers of COVID hospitalizations. So the way we've kind of implemented that in our practice to mix with that is like I said, people who are seeing a bunch of people, you work in a grocery store, a gas station, I'll screen them. If you have underlying comorbidities, you have asthma, you have diabetes, you have cardiovascular disease, okay, then we'll screen you because then we really want to, be aware of your situation, or anyone I'm worried, like, could this be something else? Am I worried that you am worried about like bacterial pneumonia? We would obviously want to rule all of that out, if that makes sense. And then going on down the list, I think if you have any questions about people I'm screening on that, just let me know. Also, Skelly, thanks for the 150. Thanks, friend. I don't even know what that is, but I appreciate you. I don't even know how you do that. Is that like one of those things where you call them a super chat? Thanks, friend. Next is, okay, I think that's everything for screening for COVID. It's hard. One more thing on that. It is challenging with screening. And this is a question that a lot of people ask me. Everyone wants to be screened, and we don't have enough tests to screen everyone. I don't know how all of this goes down, but we didn't like send it into the private sector, I think, soon enough. I don't know. I don't know how we don't have enough tests. That's not what I do in life, but we don't. So we are now allocating the tests that we do have to the best places, but we just don't have enough. So we are not testing nearly the amount of people who have the illness, which is part of the reason why when I don't think the numbers are in any way to be trusted about like anything, because so many more people have it than we're screening. Because we're still telling everyone with mild symptoms, if they have mild symptoms and they don't have another condition underlying, and we didn't go through like the things on the list that we just went over, if they don't have any of those, then we're not screening them. And how many of those people are at home? There's a lot of those people at home. that was the other thing with the screening. If you have moderate symptoms or above, we'll screen you because we want to know. And that's a lot of the times when we're ruling out like something else, do you maybe have bacterial pneumonia or something that we would actually treat rather than a virus, which we can't do a bunch for. So I lost my train of thought. That's not shocking. But that's kind of how we've been, in terms of talking to patients about why can't they be screened? A lot of educating just on that because people call and they're very, very frustrated. Understandably, they want to be screened and then we're having to say, hey, you can't be screened and this is why. And I've just been saying like, it is frustrating. We do not have enough tests. Like that is why. There's no like, in a perfect world, you would be screened, but we don't have enough tests. So we're allocating them to people who it would change our plan of care. And for you are like, I'm just pretending that you are the patient that I'm explaining it to over the phone. You are under 65. You have nothing else. Otherwise, you're healthy. You are statistically, you will recover from this without any intervention. So rather than having you go somewhere and use a test for someone who it might change our plan of care for, we are kind of triaging this. So in a way that if you're symptomatic, but you're likely to recover, we're not going to test you. And it stinks. And I say that it totally stinks. And I wish we could test everyone and it's not fair. And it's hard not to know. I tell them if I think they do have it, I do think you have it. Here's what our plan going forward. And I wish it was different, but it's not. Now I do then go over the whole spiel of, here's what we do from here. I want you to carefully monitor all of your symptoms. If this is getting worse, if your shortness of breath is getting worse, if you really feel like you can't breathe and it's not going away, so on and so forth. If you're getting worse, not better, be in close contact with me. And if nothing's improving, go to the ER if we're not in the office. It's not going over crazy well. I've been screamed at a lot this week by people who are unhappy with that answer. But there's really not. I try to just remain calm and realize that they're frustrated. And that's very fair that they're frustrated, but it's not a situation that I can control. So even if they scream at me, I'm not testing them. A lot of people ask that. They're like, do you just test them if they yell at you a lot? And no, I'm not testing them if they yell at me a lot. It is what it is. And hopefully, it's not fun. Okay. Next little rant. Nurses. I've gotten a lot, obviously, one of the other huge things with all of this is there's no PPE. This is especially a problem in the hospitals there's just no equipment for not only nurses, respiratory therapists, techs, physicians. There's just no masks, no PPE, and obviously healthcare providers are getting sick. JCAHO did update today. Part of my rant was going to be about how you're not allowed to bring your own mask in to protect yourself, and people are getting fired for bringing it in. But JCAHO just announced today, and I'll link it down below, that they are allowing you, they recommend that you should be allowed to bring your own mask and protective equipment in from home if the hospital can't provide it for you. So I'm hoping that in the next day that all of this, hospitals will implement this and you can stop getting fired for protecting yourself, because that is ridiculous. You should be allowed to protect yourself if they can't protect you. Next rant on this. There's been a lot I've seen on Instagram, and I've honestly been off of Instagram a lot, but because it's just stressful, and this might offend some people, but it's fine. Your job is not your job to put yourself at risk for your job. I guess that was worded poorly, but it is not your responsibility to endanger your family or yourself, expose yourself. If your hospital cannot provide you with the proper equipment, it is not your job to lay on that sword, okay? I feel like a lot of people think that nursing is I don't know, it's a job at the end of the day. A lot of people like to fluff it up and they're like, oh, it's my calling, and that's great if it is. And it's not I love my job, I love what I do, but I am not willing to die for my job. You know what I mean? And I think there's two sides to this whole thing. And a lot of people think that, it's I've heard a lot of well, you signed up for this, but I didn't sign up for this. Nurses, we signed up to do our jobs being protected by our, not, protected, with the equipment. Yes, I'm there to educate patients and help them when they are sick, but not in a way of putting yourself at risk. You know what I mean? This is I've seen a lot of, on the other side, people being no, you don't have to catch yourself on fire to keep other people warm. This is your job. And I understand that some people take it so much more personally than that, and they make it like their entire persona. But at the end of the day, like, yes, I'm a nurse, but I'm also like a mom, and I like have other like I'm a person outside of that. Like that is my job. You know what I mean? And it would be insane if Joe, like, say this was going on. Joe's my husband. Let's say Joe had to go into work and he was going to be exposed to this. Like everyone would think that's insane. He works in computers. Like if he was to go into work and they're like, yep, you got to go in and keep those servers and all those, the internet things that I just say that he works on computers. I don't know the details of his job. People would think you were insane if you required computer people to go and get coronavirus at their job and just being like, oh, well, we can't protect you. Like everyone would be like, no, that's not wise. But because it's health, like a nurse, they're like, well, this is like what you are and what you're doing, or a physician, and this is what you signed up for. It is not, okay? So if you want to still go in, like, go in. That's perfect. But if you, I don't know, I just feel like it's okay if you just say no. You know what I mean? And you're in a position where, like, if you have to make the choice of, like, am I going to keep my job or am I going to not expose myself over and over and over again in a situation that I know is unsafe? Like, I know I have no power to absolve you of any guilt, but do not feel guilty, because at the end of the day, you are so much more than just your job, and no one needs to die for their job, especially going in knowing like that your job shouldn't be life-threatening. Your job should never be, in this case, life-threatening. So that's my tangent there. Do not feel bad. By all means, if you are someone who feels like the need to go out and do this anyways, like, wonderful. That is wonderful for you. But if you're someone who just feels kind of that you're like, oh, this is not what I signed up for, you are correct. You did not sign up for this. You do not need to jive for your job. And it's, yeah, just don't. It's not worth dying for your job, guys. It's not. I've seen lots of travel nursing contracts. Like a lot of people in some Facebook groups I'm in, they're like, oh, well, the travel nursing contract is like $5,000 a week. It's $5,000 a week because there's no PPE when you get there. Like, and if you want to take that, like, that's perfect. Go for it. You will be helping a very critically short of staff. Those words don't make sense, but you know what I mean? But don't feel like you need to. Okay, getting off of that soapbox. I will try to also link some helpful Instagram people who have been, I've just been honestly like, a lot of people have been like, why haven't you been posting about this? And it's because I'm so angry. One, about like the whole, we don't have protective equipment, and everyone's just like, oh, well, like if your job is what you signed up for, it makes me really angry. And the other is like, I don't have anything positive to say at all. I'm just like frustrated. I'm questioning my own, like, when do I stop? I mean, I don't feel like I want to go into work if we're going to be out of math. You know what I mean? I don't have a lot positive to say about all of this. So I've kind of like stepped back a wee bit on social media, especially Instagram. But I will leave some links to people who are being much more active and helpful about it, and like post all sorts of great information, and better than I have, because like I said, I've kind of just bailed because I've been like, I can't hang. Okay, I'm going to scroll back. Bear with me for a second because I've just been kind of ignoring messages for a wee while. Emily Ram said, does a mask help? So if you are, it's better than nothing. So outpatient, we are wearing surgical masks. Now they can't decide whether it's droplet, airborne, whatever. If I had someone who was ill and had symptoms, I would want to wear an N95. I would not feel comfortable seeing them without an N95 on, and that's what's going to protect you from aerosolized, like airborne precautions. Droplet is, it's better than nothing. So that is what we are wearing. The problem a lot, if I was doing a nebulized treatment in the office though, I would only wear an N95 because at that point it can make it airborne. A lot of people, Alina King, what's your opinion about some articles saying COVID-19 is a bioweapon? I don't agree with that at all. At all. I think that's just kind of racist. And I just don't agree with that at all. It is not. I don't have anything else to say. I do not think so. Should we trust the numbers coming out of China? It's hard to believe America has overtaken. You can't trust any numbers. Everyone's numbers are off because we're not testing. So we're not don't even look at the numbers honestly, because we're testing probably maybe a tenth of the people that actually have it. And that's, I think, being generous. So I wouldn't really look at the numbers at all, but I think it's definitely on the beginning and it's only going to get so much worse. It is definitely, Zan said, it's hard to see this look like from a student. And I've had so many students say that to me, and I can't even imagine being a student like watching this, because it is a challenging time to be in the profession, and making a lot of people who are in it, including myself, you're just like, what? Like, it makes you kind of want to honestly leave. Like, if we're being honest, I'm like, I didn't get into this to be not protected. And so I can't even imagine being a student looking at it and being like, well, dang, like, what I have to look forward to. Although I do think we're going to learn a lot from this, at least I hope. And hopefully by the time the students and all of you, if you're a student, you get into it, that it'll be a totally different culture and environment. At least that is what I'm choosing to hopefully believe, is that we'll learn something from this. Mandy says, currently working on a COVID floor. Oh, thank goodness for you. It's a mess up here. I have a feeling a lot of people are going to have PTSD from this. Oh, well, I hope you are safe and that you have like masks and all the things first. And I think I agree. I think it's going to be very traumatizing for a lot of people. Kids with asthma, are they considered high risk? Elizabeth Marquez, yes. Asthma, COPD, any kind of heart, coronary disease, diabetes, like we had talked about. Those are all any kind of like autoimmune, anything like that, you're in an increased risk, not of necessarily getting it, but of not being able to fight it off as well. I think that's a pretty big misconception, is you're not necessarily at a risk. Everyone's kind of at the same amount of risk of getting it, because no one's immune systems can fight it off yet, because none of us, or like no one's immune system is immune to it yet, because it's a new, that's why it's a novel coronavirus, is it's a new coronavirus. So everyone's at the same risk of getting it in this case. But if your immune system is compromised with one of those because you have something else going on, you are at much more of a risk of getting sick. Whereas someone who doesn't have those things, their immune system might be able to, like, bat it down a little bit easier. Josh said you can FaceTime from a Mac iPad with an iCloud email, so you can set up on an Office iPad for FaceTime. Oh, that's a good. We don't have an iPad, but I mean, I have an iPad, so that would actually be a good idea. So that's a really good tip if you don't want to use your own phone and your patients have FaceTime. If you want to FaceTime with them to do the Medicare to get video chat, that's a really good idea. Brittany said, do you think nurses should be wearing surgical masks the entire time they're in the hospital? I've seen some nurses doing it. If I was in the hospital, I would be doing it. If I'm in the office and someone is within like 6 feet of me, whether I work with them or not, I am wearing a mask. I'm not playing. And I would, because you do not know how many people have been in those like, think about how many people are asymptomatic and wandering around, and you could just like, they've coughed in the air and you walk by and it can be floating around for like 3 hours and you've slurped it up, and no, I would be wearing a mask if I walked into a healthcare facility. A lot of people said the video stopped, so hopefully it restarted. Why is the government not developing testing if people seem to have built immunity? I stopped not developing testing to see if people have built immunity. I don't know. I don't work in the government. I have a lot of frustration over the whole issue. Let me see. Can coronavirus cause honeycomb lungs? I don't really know. I know it's causing like scattered infiltrates, so impairment throughout, rather than, so with pneumonia, usually you get one lobe. You have 5 lobes of your lungs. Usually you get one lobe is usually affected. However, with coronavirus, it seems to be scattered throughout all of them, which is alarming, because in pneumonia, usually you can kind of rely on the other ones that are not affected. Even if it's a couple lobes are affected, you can, ramp it up and they can kind of help. But with this, it's affecting all of it, and it's just like swelling and inflammation, and it's not great. Patients. Let's see. Do you think the virus was in the US before the news actually said it was? I don't know. There's been like a weird flu type virus that's not the flu, but I don't think so, because I think we would have seen a lot more people like sick like they are now, because people would come in if they couldn't breathe. So I don't think so, but I don't know. How are you coping with all the meanness? It's hard going into work to face this, but then the visitors and the patients are anxious and horrid, and all the staff is horrible to each other. That is hard. That's a huge, if you watched my last week's video, I was just like discouraged and sad. And I feel discouraged and sad. I am off this week, and it's hard. I don't want to go back in because I know I'm going to get yelled at. I was telling Joe last week. I was like, this is just going to be like, I'm going to have bad days for a long time. And that's just like, and I work outpatient. So I'm even on like I can't feel like I can't even complain because there's so many of you that work like in hospitals and are dealing with all of that. And I just don't even want to do it because people are sad. And I understand why they're sad. Like if my loved one was in the hospital and I couldn't visit them, I would be so angry. And I get it, but I would be so angry. And like you are then like, you can't get updates, you can't get anything. So it's such a stressful situation on every side. And then you as the healthcare worker, you don't want to get sick, obviously. Like there's just so much stress on all sides of it. And it's exhausting. And it's ridiculous. I've been trying to like exercise and avoid social media because I would go to work and then I would get like yelled at all day, and then I would come home and go on Instagram and like scroll through my feed and realize like, oh, everything just like sucks. And that wasn't healthy. So I kind of chopped out what I could, which was Instagram, and then exercised when I could, tried to like eat healthy so that like other aspects of my life were good, but there's honestly like no great fix for it. It just totally, it's not fun. It sucks. And I don't like going to work. And I hate, I'll just be honest, I hate working in healthcare right now. It is hard. Everyone, it's really, really hard. So that's honest. And a lot of you are agreeing that, yeah, like you've had a whole bunch of people saying that you either should go into work and that you did sign up for this. Ugh, but yeah. Ugh. Any advice on... I'm so angry too. I've been raising my voice for years. Yeah. No, and our healthcare system just isn't, it was already so precarious, like a lot of you were saying, and now it's just, we're starting telemedicine visits tomorrow morning in the outpatient cardiac office I work at. Hope it goes well. I hope it goes well too. Good luck. Actually, one positive of it is like, sometimes it's not like terrible to talk to your patients over the phone. I found they're much less chatty. There's a lot, not that that's like, I like that when they're chatty, but, when we talk about their things we're talking about, it's much more likely to stick to the 5 that we had planned on versus the 15 that it can sometimes develop. Because you know how sometimes people come in, they're like, my left toe is hurting. And then like 45 minutes later, you're talking about how their second cousin's wedding was outside and it rained. And you're just like, how did we get here? That's happened a lot less. So my visits have been much more succinct, I will say. So I hope that's how yours are too. Today, our schools gave the dreaded news that today is the last day to drop pertaining to those who were not able to complete their clinical hours. That is sad. That is frustrating. I've also gotten a lot of questions about clinical hours and do I think students should be allowed to go into the hospitals for nursing students and complete their clinical hours? And do I think that they should be able to complete their NP clinical hours? And honestly, I don't. And I know it's not a popular answer. But one, nursing students going into the hospital, you're just using up further PPE, and it's not a good learning environment. This is not an environment that anyone wants to learn in. No one is going to want to train you right now. So just like your training is so important. Do not let this be your training because like we had just talked about, everyone's grumpy. No one wants to be there. It's chaos. It's not going to be a great learning environment. Same, and in terms of NP students, like the exact same. Everyone, like we don't know what we're doing with telemedicine, so I don't have time to try to figure out how on earth am I going to get reimbursed for everything I'm doing. I don't know if I'm billing and coding the right way because I've never done this before. I've never done telemedicine. I have never, like the phone is ringing off the hook because everyone's worried. I don't have time to teach a student. This is not a good learning environment for students, and I've talked to a lot of NP students who are frustrated that they're unable to go into clinical. And that's what I've tried to just say is like, this is not, like your clinical hours are so, so important. We don't get enough of them, in my opinion, different rant. But do not like, and I know it stinks, like your graduation is probably going to be postponed and that absolutely, absolutely stinks. But one, like, I don't know, it's just not worth it. Like your learning is so important. I know it's probably not a popular answer, but it's not a good learning environment right now. I think some people are asking about like pre-nursing. I think your prereqs will still be fine, like online. Sydney S said, what do you think about people going out in public, like grocery stores with gloves and masks on? Do you think these precautions help and we should be doing it? If you are immune compromised, I guess like maybe I would wear a surgical mask. Maybe I'm not wearing a mask. I guess maybe I could wear a surgical mask. I don't know. Gloves. I know enough about myself that I will have good hand hygiene. I am actually not going out to the stores. Joe is going out. Like we're not bringing the girls. And in terms of what we're doing, I got a lot of questions about like, are we wiping things down or what are we doing when we go out? So what we're doing is just Joe is going out. He's going out like once or twice a week. He's not wearing gloves, but he is being very, very cautious to not anything he touches, like obviously not touch his face, not put anything in his mouth, anything like that. He'll go out, he'll go grocery shopping, come back home, and then we have like a buddy system. So I open the door, he brings everything in and we put it on our kitchen island, we wipe it all down, and then we go back and so we wipe everything we brought in the house down in case other people touched it, then we don't get it everywhere. Wipe it down, and then go back and Clorox everything he touched since he got in the car handles, steering wheels, doorknobs, where Clorox, and then kind of like work backwards from there so that everything that he has touched and he changes. So he comes in, he's decontaminated, everything he's touched is decontaminated, and then we put the stuff away and then Clorox the counter down. I'm also wiping down all of everything, like I do that with us when we come home from work. Everything I've touched gets Cloroxed once a day. I'm also just going around and doing all of our doorknobs, all of the toilets, flushers, all of anything we touch pretty much. Now I have it like down to a science, like what we touch, but before it was kind of like, ugh. So now I've kind of gotten it down to a routine. So that's what I've been doing. I don't wear gloves. I think gloves, like if you are a habitual mouth toucher, then maybe that would be helpful. I have honestly considered like maybe one mask to wear out, but I don't know because then everyone's like, but it would just be a regular surgical mask and I would like rewear it. Then I'm like, I don't even know if that's helpful, if that at that point it's like contaminated, but I don't really know if I don't think that's probably helpful. I think that's probably just the media getting to me and making me paranoid. My hospital, Brittany McDonald said my hospital just released that they're going to start collecting masks and N95s to sterilize them and reuse them. It just seems so weird to me. Oh my gosh, that sounds disgusting. I'm sorry. My hospital wants us, Lila says they want you to reuse gowns. Ew. That just sounds like I am so sorry. So many PIC nurses are asked to go to units that are holding on to N95 masks for their staff, and I want to go and encourage a place like the line. So disturbing that people would think it's okay. Yeah, I think this has brought out a lot of like nastiness in people, and some good, but a lot of not good. Oh, guys, I'm stressed and I'm having PVCs. So I'm going to take a drink of water and see if I can calm my heart down. Is it bad? My dad's cousin bought 100 N95s. Why do you need 100 N95s? Like have one. If nurses are allowed to reuse the same one for like ever, and apparently we're now like just sterilizing them, I think one is fine. Oh, that makes me angry. I'm a CMA in a family medicine, and our clinic is preparing all staff and providers to do training to work inpatient med surge. What are your thoughts on this? Is it happening in your area as well? I am not sure. I'm sure it is. I guess I should say probably is. I know lots and lots of hospitals are pulling their staff from ambulatory care or outpatient care in to go, and they're reallocating them. I have heard of that a lot. I do not work for a large health system. I work for a private practice, so I would have nowhere to go. I can't get called anywhere. I might just get laid off, which is, I'd rather be laid off probably than do that. And that is where I think you just have to be really careful about if you get pulled in, just knowing, you know what I mean, your rights in order to refuse. I saw something, and I'll try to, if you're on Instagram, I posted it in my stories, and it was OSHA's regulations, and if I can find it, I'll link it, of how to, if they're unable to provide you with proper protective equipment, you shouldn't quit. You should just say, I refuse the patient or something. I'll find it and I'll link it. That way you could get like an attorney and say that it was like wrongful if they say, well, you can't come back, and they're like firing you for not, like if they want you to work without an N95 mask with COVID patients. You could then for like get legal action rather than them just being like, well, you're fired and nothing happens. You know what I mean? So I'll find more out about that. Probably wasn't helpful because I don't have all the details. Do you hear what? Did you hear about the news that the FBI arrested a man in Brooklyn who had enough masks to fill a hospital? No, that's insanity. Oh my gosh. Ugh. We're completing clinical. Andy Hofing said we're completing clinical online as well. ATI has an application that lets you pick what you would do in a clinical setting. Obviously not optimal, but better than nothing. Yikes. Yikes. That's all I have to say on that. Catherine Shaw, how do I feel about sterilizing N95 masks? That seems gross. That's not what they're made for. I don't know if anyone's looked into like, should that be like, what is their efficacy after that's happened? And gross, like gross. I don't even know if I would not want to share an N95 mask with like one of my BFFs, let alone some rando that works in your hospital. Brittany McDonald, I'm in orientation. I did not envision my new grad life starting like this. Yeah, I am so sorry that is how you are. Welcome to the world of nursing. We have had patients coughing. Zan Lutsky said we have had patients coughing in our faces as assault. Oh my gosh. Any advice on how to navigate the legal system when they say we're too overwhelmed? No, I have not. Man, this is not a positive. This is not a positive live stream. I have not had a lot of, if anyone knows, please let me know. But I have not had a lot of positive experiences ever trying to do legal implications with patients because they will always claim, how it's like, oh, it's a felony to hit a nurse. I've been hit many times and bit and slapped and all the things. And I've never had any luck with legal anything because they always say like, oh, they were confused or they were delirious or like they were not in their right mind. So no, I'm no luck there, but I'm also very cynical about it, as you can see. I'm so sorry that has happened to you. That is extremely unacceptable. One crazy nurse said that, and that's a good point. One crazy nurse said, I've been concerned about the possible implications of inpatient coming from an ambulatory setting. It's not something I've ever done or trained on. And you take care of yourself too. That is a whole different thing. Like, how are you supposed to go inpatient? I was talking to some people who said they were, pulling from all sorts of units into like a COVID unit. And how, if you've never done that, how are you supposed to do that? You know what I mean? Like, if I worked in adults, but say I had only worked in like the peds or the NICU, like I'm not going to know how to do it, like do with adult things. That is insane. Liz says there was a doctor who coughed on or hugged multiple people intentionally to get them sick. Oh, good. He's at least facing charges because that is horrific. Horrific. This is not a positive live stream. I think a lot of, okay, good. Hopefully none of you, hopefully this live stream, it's not, Violin Chick was like just laughing at the fact that I said it was not a positive live stream. So hopefully not all of you are scarred and I told you it would be real and this is real and I'm kind of grumpy and just stressed about the whole situation. I think a lot of everyone is. Does or did the public have access to buy PPE from medical supply companies? Hoarding is occurring, but I don't even think it's happening at a med-level supply. It's from people going to Home Depot and Ace. I think it's from like Home Depot and Ace, maybe from medical supply companies, but I think most of it is probably from that. Mike Glitch says, how difficult is it for you to get your patients tested? It is challenging because for a little while we had, it's hard. We have to now go through the health department. We were given a few, because the health department tests people and then private labs can test people. So like LabCorp and Quest, at least where I live. I don't know if other health systems, if they were big enough, like their own lab could create something. We don't have our own lab because we're private practice. So we only had like say 15 tests or whatever it was. And we blew through those like fairly quickly. So now we're relying on the state. And so we kind of just like triage them to them. And then we have to write a note saying, this is why I think this person has to be tested. And then they decide. And honestly, we don't find out if they were able to get tested, unless the patient calls back. and says that they weren't able to be tested. Would you consider quitting to protect yourself and loved ones? Yes. I talked about this a little bit earlier in this, but I would not, yes, I don't think, I mean, it would be very challenging financially, obviously, is a huge thing, but then you have to kind of weigh, you know what I mean? Like, my life is not worth my job, because at the end of the day, like, I like my career, but I am not my career. So, yes. And I think at the end of, like, if in terms of how long you would be unemployed, like, you could look for a different job. The Resume RX, if you don't follow her on Instagram, I will leave her a link down below when we're all done. She has a lot on like interviewing and how to interview in this whole age of everything going wild. I think you could A, get a different job, and B, if anyone ever questioned why you quit, you could just say like, they didn't have personal protective equipment and I was not safe and I was not willing to get coronavirus for my job. Like, and there's really nothing anyone can say about that, because they're probably like, no. I'm counting up my living expenses in preparation for quitting over lack of PPE. I mean, I feel you. Like, Joe and I have had that conversation. I was like, Joe, I would quit if we ran out at work. He's like, I mean, okay, like, okay. It's stressful and it just stinks. And I hate that this is like, I'm in disbelief a bit, but then not at the same time that these are the conversations that we are having. Let me see. Okay, I think I might be caught up. So let me see if I had any from Instagram that I didn't get to. Thanks for hanging out, by the way, guys. I always get nervous with these. I'm like, I'm going to be the only one. It's fine. I talk to myself all the time, so it really wouldn't even probably be that big of a difference. Okay. Ways to calm fear and anxiety about COVID. So these are a lot of, we talked about this a little bit before. Exercise, I think, is huge. There are a lot of free exercise things on YouTube, and I know a lot of different fitness apps are offering like a free, whatever, 30 days, 60 days, whatever it is. I think Peloton is offering a free thing, and they have a lot of workouts you can do at home that don't involve, like, you don't have to have anything. So if you guys know of any like workout things that are doing free things, I know I'm saying things a lot, just write them in the chat. But I think they're doing it. I want to say something Nike one maybe was doing a free running one. Yoga, there's a ton of yoga on the internet that is free. You can just type in whatever, yoga for anxiety. I'm sure Yoga with Adriene is someone who's great that I love watching. Random fun fact, my mother-in-law is a yoga instructor and just started a YouTube channel, so you could go on that. I'll leave that link down below. There's a lot that's free online. And yes, Liz just posted at the Resume RX. That's who I meant in terms of the resumes. So I think exercise is huge for reducing anxiety. Trying to sleep as much as you can. I've been prioritizing sleep like above all else. I'm like, oh, I didn't get that done, which is not like me. So sleeping, avoiding social media, honestly, which is ironic coming from me, because that is just a cesspool of negativity at the moment, and just stress. Like, you see it and you're like, oh, wow. Like, you know what I mean? You can't go from your stressful job to all you hear is bad, 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 which is why I've just been posting pictures of my dog and my babies, because I was like, well, they're cute. Like, this will be fine. Maybe it'll make someone's day better. And then sleep, eating well if you can, and just like taking care of yourself. Deep breathing, meditation. I'm not like a meditator person, but I do try to like take deep breaths. Peloton is trying to make me a meditation person. I usually just fall asleep, but whatever. I mean, that's also very important. But anything like that, very helpful. Deep breathing. I've been doing a lot of deep breathing. My whole family, which was like, why are you sighing so much? I'm like, I'm not, I'm deep breathing. But, and a lot of people are saying like sleep and immunity are linked. Yes, sleep, guys. Sleep is huge. And you can, I don't know. I cry a lot less when I sleep more. The other day there, I was very low on sleep because Piper is like something is going on with my children, and I was not sleeping, and I just cried the whole day. So I just slept a lot, and now I feel a lot better. So sleep, tangent there, but sleep is wonderful. Um, the head of my, I've been trying to stay off the news. Yes, do that. I work as a tech. Oh, I got behind on messages. Hold on with me. Brittany McDonald, my manager, said I would be one of the first to get pulled to a COVID floor since I'm brand new, which seems so backwards. That does seem so backwards. That was another thing I was going to have a tangent on. These poor states that are taking brand new nurses, like who haven't even passed the NCLEX yet, and having them work. Like, I get the idea is there, but like, could you imagine starting your nursing career? And Brittany, I'm hoping, I'm just crossing all my fingers that this doesn't happen to you, on a COVID floor. Like, that is just insane to me. Like, insane. You really need to have your feet under you before you go into that madness. So I super hope it doesn't happen to you. Like, so many fingers crossed. Zan Letsky, the nursing shortage existed before this and it will be extensive afterwards. I think there's going to be a huge, at least from my friends who I've talked to, a huge reevaluation of priorities of, do I actually want to, I think this has shown a lot of colors in hospitals of how much they actually care for you. And it's not a lot in most of the time. So I think a lot of people might be changing where they want to work. Like maybe they want to work outpatient or more in, there's a lot of different types of nursing jobs. And I think we're going to see a lot of nurses exploring those because it's when you really need to be protected and the hospital just kind of says like masks are too expensive, or like, well, we're not going to get those for you. Whatever the reason is for not having the equipment to protect you, like that really shows where their priorities are. And most of the time it's not with us, which stinks. I know Crocs are giving away free Crocs, and Starbucks is giving away free tall, hot, or iced coffees to medical professionals. Well, that's a delight. I mean, Crocs, that could be comfortable. I've never actually tried on Crocs. Dr. Fossey said that they are projecting 100,000 to 200,000 deaths from the virus. Should I be writing my will, or can I just carry on? I mean, I think you should have like a plan in place. Someone should know what you want to happen. You know what I mean? Someone should know. If you have children, this has certainly lit a fire under my booty to write a will. But yeah, I think we should just be more aware. Someone should know about what you want. And I mean, if you're in it's just a mess. But I do think it is going to be hugely problematic here, especially because a lot of people are not doing social distancing at all. Like, I feel like I think people are social distancing because my bubble is medical people. And, but then I go and venture it like out in the world a little bit and see that like no one is. Have you seen COVID-19 in pediatric patients? I work as a nurse tech in a children's hospital. I'm curious about your experience. So I no longer work in peds, but I have heard of pediatric patients having it. Yes. Not as many, not nearly as many, but yes. There have been a couple pediatric deaths that I know of. One crazy nurse says one way of cope with stress is adult coloring books. Coloring books are legit. Highly recommend. And Liz agreed. She said, I can appreciate those cute photos. Super conflicted about sharing medical information versus cheery things. And that's, I think, something that's been really hard. And you guys can let me know what you guys think down below too, is I don't honestly know what to post because I don't know everything I have to say. It's not going to be positive. Like how I am feeling about everything is not great. I am really angry at the healthcare systems. I think this is going to get a lot worse before it gets better, but I feel like I don't want to go on the internet and see that necessarily because, like I said, I've been avoiding it. So I don't know what you guys want. So let me know down below if you want that. And that's been my concern about vlogs too. It's why I'm like, I'll have one this week, but it's just one day. Because I feel like every day would be the same thing of me being like, well, this is stressful and I don't have a solution. And that's kind of exhausting to hear. So it can also, I guess, be like, I don't know. So let me know what you want, because if not, I can just like take a step back from everything. But it's hard to kind of balance that because you want to be realistic, but not so sad. And it is challenging right now. Let me see. Christine Dobbs, do you consider changing your profession? So, yeah, or changing what I do. Like this has made me really look at telemedicine and be like, well, you're appealing. Um, if we're being real, I think if I worked bedside, it would for sure make me reevaluate like at least where I worked. You know what I mean? I think some hospitals are doing a really good job. I have heard some hospitals that are doing such a good job, and I think it would make me reevaluate that. But it does make you kind of be like, I still really like what I do. But I also like me and my family, and I'm not willing to put them at risk. And I feel like our healthcare system is not caring about that. So that makes me be like, well, um, so yeah, there's that. Text. A lot of people are like, Emma Levine said they're doing, as text, they're having like spotting people who are donning and taking off the PPE. Cheryl said, I wonder if the entire U.S. health system will change after this is over. And I think it will. Something will be different, whether it's for the better or worse, but it will be different. What I'm really curious to see is if it is different in terms of like telemedicine, because obviously I'm more thinking like outpatient, because I feel like now that people have gotten a taste of telemedicine and it's worked fairly well when it has gone well, I feel like people are going to be, for a lot of things, like rely on that. I know like teledoc's been a thing for a long time for like urgent care type things that are appropriate for it. But I think there's going to be a big push for that, for like, do I really need to go in to have my cold evaluated? Like, why can't we do this over the telemedicine? So I think that might be one way it's changed. Maybe we'll be a little bit, hopefully, more prepared if this ever happens again. I don't know. I would hope that there would be some more, public would be more aware of it. I hope that positive things do come out of it. My mom lives in Raleigh and thought people were social distancing when they went to Myrtle Beach. Oh my gosh. I realized no one here was social distancing. Yeah, no one is. It's so frustrating. My neighbors go on like walks in packs. Everyone's having people over. It's just so frustrating. My neighbors like legitimately had a concert outside their house the other day with like all of their, I think it was a, it was so frustrating. They had like all their friends over and they were just having a concert on the front yard. I was like, it's fine. Hi, Alexandra Cushing. I'm an RN for an electrophysiologist at a small physician-owned hospital, and your video was so helpful as we transitioned to telehealth. Oh, I'm so glad. I feel like I made that, and then I was like, maybe, like, I hope this is helpful, but I also hope I'm not, like, the blind leading the blind here. So I'm glad it was helpful. What do you think about the Netherlands are doing in a right, or are they going in, is it gone in a few days? I don't know. I don't know anything about the Netherlands, unfortunately. Will Emily Ram, will this crisis make America have a universal healthcare system? No, probably not. One can only hope. But no, I'm not hopeful for that. I like a mixture. I like the realness, but also finding positives. I know. That's why I have struggles, because I'm not finding the positives. I'm struggling here. Telemedicine, I agree, Rachel, is brilliant for certain issues. I appreciate the realism of your thoughts. It's also disappointing how we're handling this. It is. I know. It is frustrating. A 7-year-old in Plano on a vent. My NP loves telemedicine and says she might never go back. I said that the other day. I was like, I had only seen telemedicine patients that day, and I was like, I'm so mad, one, that I wore real pants, and two, like, I could sort of get used to this. Post what is real. Make a disclaimer in the beginning. That's true. I just get tired of disclaimers. This has turned into like a ramble, so thanks for being along for my ramble. It's a ghost town in Massachusetts. I am so glad that it is a ghost town in Massachusetts. At least someone is obeying the rules. And Chicago. Okay, so Chicago and Massachusetts. So now we all know where to move, in case you were wondering. Sometimes it's best to avoid the hospital to contract things. Yeah, avoid the hospital like the plague. I have been like so paranoid about Avery, like everything. She's like a crazy person. I'm like, you will not climb things. Like, we are not going to play with anything that is in remotely, like, anyone could choke on it. No one is doing anything fun. We're all going to sit here and watch TV safely. Okay? No one's going to the hospital. Piper's not allowed to try new foods. Like, we're not playing. We're really enjoying, Alexandra says we're really enjoying telehealth. Of course, it isn't an option for everyone, but it makes sense for a lot of patients. It really does. Med checks, like, why can't we do that over the phone? And then you can send me a picture of your leg and I'll be like, yep, that's less swollen or more swollen. Like, you know what I mean? Like, it just makes sense. I think it's hit harder in places that have been more enforcement. I live in a cul-de-sac with an anti-vaccine microbiologist. Our kids are all hanging out in the street. Yep. Oh yeah. Like bouncy house included. Yeah, that's been happening. All right, let me see if I have any more questions on. There were a lot on Instagram. Your friends in Philly. You know, I have family in Philly, and I'm just like, has your census been lower, and how have you combated this? Ours has been lower in family practice. Our census has been a little bit lower, but now that we've really ramped up telemedicine, it's actually gone a little bit back up, and it's more-ish where it was. It's still a little bit lower, but less. Like in the beginning of the week, she was like, Liz, I think I'm going to have to like have you not work for a while. And towards the end, she was like, okay, maybe you can keep working. So enough to kind of sustain functions. And that was after we called a lot of people and like sent out emails and let them really know how we were handling telemedicine, because people were just scared. They were canceling their appointments without finding that we had like transitioned into this telemedicine thing. So like now things are slowly picking back up. For right now, it's kind of hard. We'll see how it goes in the next couple months, because some things like can't be deferred, but a lot of things can. So that's been sort of like picking back up, if you know what I mean. I'm having, should we, in an outpatient COVID positive patient, how long until their symptoms resolve until returning to work? So in terms of having your patients return to work, it's if they were positive, known positive, and the health department should be educating this to them. It is 3 days after all symptom resolution, so all symptoms, or 7 days from the positive, whichever is longer. So if that makes sense, say they had a really mild version, they tested and they was already like decently into it, they still have to wait at least 7 days, self-quarantine. But let's say they got tested and, they still have a cough, fever, whatever, 3 days after all of the symptoms resolve, which is usually 2 weeks at least, usually. And if they're just exposed to it, this is another thing we've seen a lot in primary care. We're having them wait 2 weeks. Say they have like, a known sick contact and they were exposed to it, they can't go back to work for 2 weeks because they've found that it takes about, the incubation period is usually a little bit less than 2 weeks. So then hopefully that will be fine. Are you testing based on the CDC guidelines or your own discretion? Kind of talked about that more in the beginning. And it is kind of a combo of both. I read the CDC ones and then I kind of just made them better in my opinion, but it's still, we're barely testing anyone. What is the best ways to ease patient anxiety about this? Just educating them about it. One of the big things that people struggle with is, like we said, not getting tested, but just educating them that getting tested isn't going to make them better and it's not going to change our treatment. Can you please recommend any online teleconferences that are relevant to the issues of today? I'll link some, I don't know any conferences, but I'll link some people that have had really good information. Are you getting requests for okay to work notes from employees? I've had numerous people tell me if they call in sick to work, their employer is requiring a note. And yes, I have been getting a ton of that. So, that has been. So I've been writing as long as much more liberally than I think I normally do. Sometimes people are like, my cousin sneezed on me. I need to not go to work. And I'm like, meh, but now I'm more like, meh, okay. And there. Okay, guys, I think, let me see if there was any other questions that I missed on Instagram. But also with the anxiety thing, like you're not going to ease their anxiety completely. I'm anxious about it. Most people I think are. As long as it's just like manageable and you can still function in life, that's kind of my bar. And I tell people that. I'm like, this is short term, this is not forever. Our goal is to be functional right now and survive. And we don't need to be overachieving. We don't need to be the best parent in the world right now. We don't need to be the best anyone in the world right now. We just need to kind of get through it. Function is our baseline. That's not forever, obviously, long term. You would like to do more than function, but for right now, function is kind of our baseline and what we want. How long do you think this will be going on for? At least another probably like 4 weeks, if I was estimating, if not longer. Have you had to implement locking up your PPE supplies in your office? We have already done that. We just hand them a mask when they actually come in. What does, do you think telemed appointments will be reimbursed at the same rate? They're saying they will. I mean, it's a whole mess. Like some places will reimburse it like a normal appointment. Like I said, some places you can't do the type of appointment you want, so you get reimbursed way lower. It just kind of stinks. App or program used for telemed visits. Doxy is my favorite. Zoom is backup. We talked about that earlier a little bit more. Can you talk a little bit more about plasma antibodies? No, I know nothing about that, but I will try to find some people that do. All right, I think most of the rest of them we answered in my rambles. Best process, when to advise to stay home and treat conservatively versus testing. Talked about that a little bit. If people think they might have it, should they try to get tested or just stay home? Call your healthcare provider and they'll be able to walk you through the steps, kind of like we talked about earlier. Just call. I think it's helpful to have them be walked through for you. Are you getting a lot of people who think they have it? Yes. I probably get at least 5 to 10 calls a day. How do I feel about the lack of PPE? It's horrific and not okay. I think the rest of these we mostly talked about. Okay, let me check these, and if not, we'll probably wrap things up and then head out for the evening. So sorry if this was not all butterflies and rainbows and it stressed you out more. That was not my intention. I was like, I need to go on here and rant, and I think this will be the easiest way. It's just coming on here and ranting. Let me see. How to not panic about graduating on time due to the inability to have clinical. In the grand scheme of things, Brianna, it totally stinks right now, and I totally hear you. But in the grand scheme of things, a couple of months, in a few years, you won't even, it won't be life-changing. It's life-changing right now, but in a few months of a delay will not be as big of a deal as it is right now. I promise. Right now, just cry and be ragey and really frustrated, and that's all fine. But no, in a few years, these few months, that will not be as big of a deal as it is right now, if that makes sense. What is the treatment plan for those who aren't sick enough for admission? Haley D. Supportive. Make sure you're getting lots of fluids, rest, monitor your symptoms. If it's getting worse, obviously call your healthcare provider or go to the ER, however they direct you. Someone had asked about ibuprofen. There is such conflicting, I don't know, there's 2 sides of that. Some people are avoiding ibuprofen, some people aren't. Ibuprofen because the thought being that anti-inflammatory, I think medication was being the problem. I think that in normal doses of ibuprofen, it's too low. You don't get the anti-inflammatory effect, you're just getting the pain effect. So you would have to be taking really high doses of it, but I am telling people, we just don't know, so if you can, avoid it. You know what I mean? And then otherwise, just supportive treatment, rest, hydration, supporting your body with good food when you can. There's not enough data on a lot of this. Some people have asked me what you're doing. I'm not really tweaking most treatment just because we don't have a lot of data on it. When can we expect non-emergent surgeries to continue to be scheduled again? The hospitals have been canceling everything non-emergent. Oh gosh, I would probably say May at the earliest. Probably May at the earliest, because it's just, it's a mess. And you don't want to be in the hospital right now for non-emergent surgeries. I've had a lot of patients calling and saying that theirs have been canceled, and I'm like, you don't want to be there. You don't want to be there right now. Are you going to be going back on live again soon? Maybe, unless everyone's like, this was the worst. Don't ever do it again. Jarrett said, I called my PCP and his office advised me that they were on lockdown from all flu, cold, and COVID symptoms and deferred me to an urgent care. Why is this? I thought PCPs would treat you. It's because they don't have personal protective equipment. They probably don't have, like our office does the same thing. We don't have N95 masks. So how I can't protect myself against you. You know what I mean? Whereas other places, they might have the thing to do that. However, it's harder for smaller offices to, they're trying to keep primary care going. So they would have to disinfect everything, have the gear, and the staff to handle the situation. And if they don't, then you kind of have to pick. Are you going to do sick people or are you going to care for healthy people? And it's easier to just try to have healthier people in the office, and it's not fair and it totally stinks. And it creates a huge backlog for urgent cares. And I feel so bad for urgent cares. A lot of our urgent cares have closed because they don't want to deal with it. And yeah, that's why. It's not to be mean. It's to try to protect as many people as possible. So hopefully urgent care can help you. Or you can be directed, at least like at ours, they have like centers that help deal with respiratory symptoms, and you could go there. Advice for finding a PCP during this craziness. Good luck. I know we are not accepting new patients. I know, which is challenging and totally stinks. We've actually talked about this, the woman I work for and I. Do we accept new patients? Do we not? Because it's really not fair if you need one. And that may change if this goes on longer, but isn't it unsafe to take new nurses and put them in with COVID-19 patients? I mean, I think so, but I don't rule the world. What do you think of Chinese studies and data on IVC treatment? I don't know anything about that. Any advice for a pregnant woman during this pandemic? Stay home as much as you possibly can. Like, you just have to guard yourself so much. We do not know what happens if you get it. So just be super duper safe. Why would he not treat me if I'm having moderate to severe symptoms? You just have to call them and go with whatever they say. I'm sorry you are not feeling good. Any thoughts on where new MPs can get a job during this time? Telemedicine is probably hiring like crazy. All of those telemedicine places. Take as many safety precautions as possible. You are immunocompromised. Yes, if you're pregnant, you are immunocompromised. So take as many precautions as you possibly can. Do not put yourself in risky situations. Just be safe. Some people are saying, Haley says that her hospital has doctors that are accepting new patients. So just check with the offices in your area. That is the best advice. Some will and some won't. I actually know my primary care office is accepting new patients. So yeah, I would just call around and see. I think it all depends on how they're handling, if they're like allowing people to be a new patient without having ever seen you. And I honestly think if it keeps going, a lot more people are going to start accepting new patients because it's been going on longer. Like right now, we've only been doing telemedicine for a week. So we said like, okay, no new patients. But if it's a few weeks from now, I think we'll probably change our minds. Okay. Thanks for hanging out with me, guys. Oh, wow. Okay, it's been an hour. All right. Well, we just chatted for a long time. Thanks for hanging out with me. Hopefully this was somewhat helpful and not just depressing or you just felt like, someone else was venting with you. If you like these and want to see more, just do the like thing or let me know in a comment or whatever. I appreciate you being here. And if you have any other questions, let me know. Maybe we can do a couple more about this whole situation as it goes on, and kind of let me know what you want to see going forward, because I'm so conflicted and I have no idea what you want, what to show, because I don't want to be just a voice of negativity, but I also think toxic positivity is real. If you haven't watched Katie Duke's podcast on that, you should. And I never want to portray everything's great and positive, this, the world is kind of falling apart, but here's only the silver linings, because that's not realistic. So just let me know what you want to see. But thanks for everyone who showed up today. I so appreciate all of you and for chatting with me and going along on my rambles, because I know they were there. Shout out to Joe for putting both of our children to bed. They're now quiet. You might have heard them screaming for a very long time. It's fine. Everything's fine. Have a lovely night, guys. Thanks everybody who's saying good night. Hope you guys all stay super duper safe. Stick up for yourselves. Remember, you are worth keeping safe. You are worth keeping safe, and you deserve to be safe. You are not replaceable, but jobs are. Keep that in the back of your mind. Thanks for hanging out tonight, guys, and I will see you next time. Bye, guys.